Well, good morning, everybody. Thank you for coming. We really appreciate your attendance and participation in today's event. My name is Kelly Sims. I'm the Project Officer for the Mental Health Foundation Australia and also the Multicultural Ambassador. So work in a voluntary role, working with the organisation to support our ever-growing multicultural demographic. We'll begin today's proceedings by acknowledging and paying respect to the traditional owners and custodians of the land. We pay respect to those who have passed before us and acknowledge today's Tasmanian Aboriginal people who are still the custodians of this land. It's also a really good time to highlight the displacement of these people and thinking about what we're going to be exploring today a little bit more deeply. There's been a really long journey there in regards to inclusion, accessibility, and I think it directly relates to our Aboriginal culture, the traditional custodians. On behalf of the Mental Health Foundation Australia, our chairperson, Vasan, I would like to welcome and thank each and every one of you for attending. Having a National Symposium on homelessness and mental health in Tasmania is something that we have needed for a long time. When we're thinking about it, it's intergenerational. It's shame, it's cycles, it's stigma, it's self-perception and control. It's mental and physical illness, it's human rights, it's common values, and when we're looking at systematic and institutions, it's actions versus outcomes. Sector assessment, recognising risk, a statewide collective approach, quality collating of information and reporting, short-term funding stipulations and grants, roadblocks, systematic issues, insecure housing, and last but not least, what you are all dealing with is high-level complexity. And that's something that we need to remember as well, along with all of the challenges. There are just some of the reasons for why each and every one of you are here today. We may not agree. Heck, we may not always be right. But we're all here together, and that, I'm sure, for most of you, is a feat in itself. Let's make a pact today to support a safe space. A space where we can robustly explore the facts, network, share our expertise actively, in a solutions-based approach. One thing I think we can all agree on is prevention is the key. Some common causes and challenges that I found doing research for this event was the economy. That's a quick one that we all run to, isn't it? It's just what's around us, we can't help it. Financially, socially, environmentally, physically, medically and mentally. This leads into the more free, not findings. The two of the same individuals, a collective and accessible route that's developed and facilitated to suit their needs. So what's out there at the moment in Tasmania? Doing my research, it was really difficult to pinpoint numbers of who's getting outcomes and who's working in what space, because a lot of it crosses over. But we found there was around 50 specialist services reported and directly relating to or supporting homelessness in Tasmania. Approximately 7,000 people accessed these in 2016. This figure has likely doubled with the health challenges that we currently have. These are regularly being reported by staff and clients who access these as being under-resourced, over-governed, but still lacking effective coordination, predominantly focused on short-term goals or attitudes due to short-term funding and grants also. So now we have the opportunity to be part of the solution. It's one step on the staircase, or I should probably say a flight of staircases in a tall hotel. But by celebrating the wins while critically reflecting and having courageous conversations regarding the losses is the only way we can productively unpack the key issues and start to navigate the landscape to better view what homelessness is in our state. Active participation in whatever way suits you best. That can be by submitting an evaluation form with your honest feedback on it, or it could be popping a question in the little Q&A bags we've got at the back with pens and paper, following up with me directly via email, or networking with our speakers directly here today. We have established a few breaks, and we've done that strategically to ensure that there is an opportunity to network. We'd appreciate it if you could do that safely. Try and have a distance between you while chatting if you can as well. That would be great. Okay, so National Mental Health Month. It's an initiative of the Mental Health Foundation Australia to advocate for and raise awareness for Australian mental health. It is an important time where the Australian community comes together to raise awareness and to explore just how important mental health is. The Mental Health Foundation Australia's National Mental Health Month is unlike any other mental health awareness campaigns. It aims to bring all Australians together in a nationwide conversation about mental health. And we aim to maintain this conversation for the entire month and beyond through a series of various mental health related events. National Mental Health Month is a program that the Mental Health Foundation Australia is extremely proud of, and we intend to reach out to and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussion surrounding the importance of mental health in Australia. With 1 in 5 Australians experiencing mental health illness, it is time we give mental health the due attention. And that is exactly what the Mental Health Foundation Australia is wanting to achieve. Throughout this month, many events have been organised in each state and territory of Australia, aiming to attract and unite Australians of all ages and backgrounds to raise awareness of the need for better mental health for all. As a part of the busy month, the Mental Health Foundation Australia planned to run a set of conferences in each state and territory on one issue in relation to mental health. And they've done a really great job in pinpointing the gaps in each state and trying to support that and promote some of the key mechanisms and issues that we have and facilitate networking in that space. Because we found a lot of the issues and gaps we have around the nation directly link in with a disjointment of the sector for whatever reason that is. So starting to maybe mend some bridges, get everybody in the same room together and have a safe space where we can explore some of those things we think is most important. And people sharing their expertise, because we're all experts in something and everybody knows something that we don't. So it's really important that we are open and we have those critical conversations. This symposium aims to discuss the issues around homelessness, particularly in relation to mental health, what services are available for those who are homeless and require assistance, what could be done to better these services, and how these issues can be maintained in the future. This conference will be an excellent avenue to raise concerns and bring to the attention of many key figures, including the heads of organisations, such as in homelessness and mental health, members of parliament, other officials, and also people that are actually in this space that are challenged by it. As part of the event, attendees will be addressed by keynote speakers who are well versed in their fields, and it's a really good opportunity for us to share a wide variety of views. And it will be provided and the opportunity will be provided to raise questions. And at the moment, we weren't sure of numbers. They were growing quite quickly over the last few days. So we have set up the Q&A bags so you can pop a question in there, just in case with the time frame we don't have a chance to engage with the audience directly ongoing. The purpose of the conference is to collate all of the concerns raised and prepare a list of recommendations to be sent to all levels of government. This way we can hold them accountable as well as ourselves and share this publicly. Because if the politicians don't want to listen, the media will. And that's something that we can share with the media if we don't have the level of government supporting us in the way that we need. So, all right. I would just like to introduce our guests. I won't go through all of the names. We have quite a large panel of speakers and Q&A panellists. Just like to say a very special thank you for agreeing to come today. We really, really appreciate it. I know it's not easy. There's been a lot of work done in this space, and we go to a lot of forums, we go to a lot of conferences, and sometimes it's difficult to navigate the outcomes from that and the benefits from us spending our time and day there. So I really appreciate you having trust in us and being a part of making this day a success. Also, just to get through the exciting stuff, we have the toilets that are just outside here. So if you turn left, you should be able to find that quite easily. There's just a step and the toilets are there. And we also have the emergency exits just on the other side, and they're well signed at the stairwell as well. What to expect from today. So you've probably had a look at the program or the agenda and seen that there's a whole bunch of speakers. There's a lot to get through in one day or in 4 hours. And the point of that is because looking at best practice with running events like this is to have short, sharp speakers. I want everybody to be engaged. It's more important that you take away some key messages today that you remember, that actually spark your interest and passion and motivation. And I think the best way to do that is to get as many people as we can in the room and have that breadth of expertise available to us. I'll go into a little bit about the Mental Health Foundation Australia. I think we've already done a lot of that, to be honest, in the introduction, but just from my personal experience, I've only been involved with them in the last year as an ambassador, originally volunteering around the multicultural community and supporting that. But also I am quite impressed with their approach just this year, learning about the strategic direction they're going in. They've had a bit of an overhaul internally, and they're looking at facilitating and coordinating nationally. They can see the gaps are there. There's no point reinventing the wheel. It's about championing other services and holding events like this, bringing them together and being able to promote and support evidence-based best practice within those settings as well. Who they are? Well, they're a really diverse group of people. They come from all backgrounds, they have all types of qualifications and all cultures. And I have to be really frank in saying they are one of the better teams that I've worked with in my career. The objectives and the attitudes are really, really refreshing to be working with, and to know that we have the opportunity now to access a national peak body that is the original mental health facilitators and peak body in the country. It's really exciting to see that be refreshed and rejuvenated and to be a part of that. And without our donations and sponsors, we wouldn't be able to do this. So having the Commonwealth Bank having sponsors like Australian Unity. We also have Alistair Betts Photography here today. We also have Scene Change, and they're filming today. And a lot of these people have either supported us through direct donation or sponsorship, or given us quite a heavy discount to make this happen, because obviously being a charitable organisation, it does take a village and a lot of support. So thank you very, very much for that. We really appreciate it. And also, I can't forget actually, the Glenorchy Football Club have been amazing. They've offered us an office space and helped us out with the admin and those types of things. And it's just been a really great opportunity to connect with the community and be able to share and partner with some of the information that I can provide and resources, and also for them to help support us and understand what we're doing. So that partnership's been fantastic as well. So without further ado, I will welcome our first guest to officially welcome and open us and our event in Hobart. Thank you, Councillor Irwin, for your support towards this year's National Mental Health Month event. So what I'll do is I'll welcome you on the stage now to come and have your address.
Hello. Okay. So my name's Jax Ewan, and before I begin, I'll acknowledge the traditional owners of the land we're on today, Nipaluna Lutruwita, the Palawa and Pakana people, who have survived invasion and dispossession at gunpoint and unspeakable and ongoing violence, resulting in the significant inequalities between Black and White Australia today. Is it any wonder that our nation, founded on such ignorance and violence, struggles with social inequality? I pay my respect to elders past, present and emerging, and commit myself as an ally to work with our Aboriginal community towards reconciliation. Always was, always will be. I am a small business owner, a volunteer firefighter, a very proud non-binary queer, and I'm one of the elected members of Nipaluna Hobart City Council. And on behalf of the city, I'd like to welcome you all here today to the Town Hall for the Mental Health Council Symposium on Homelessness, an issue which is very close to my heart and hopefully yours too, given that you're here today. Thank you all for coming to hear from experts from both academic and lived experience perspectives. I really hope that today's sessions are not just us preaching to the choir, but that you're each able to hear something new and something that challenges your practice to become more people-centred, or even just that you meet people working in this space who share your passion for our community, which is who we're all here for in the end. I'd like to draw a line under my introduction now and speak to you not as an elected member, but as myself and from my own experience, especially because I know that my views are not necessarily shared by my colleagues, and nor are they representative of Council's formal position. Official disclaimer. Homelessness is a policy setting. It's a conscious choice that we collectively are making through our elected representatives to not see housing as a basic human right and treat it as such. We collectively allow our leaders to maintain a system that incentivises the hoarding of wealth in the hands of the powerful and privileged. And I'm here to say that I've had enough and that we can and we must do better. I'd like to speak briefly of my own lived experience of homelessness and the importance of centering the voices of people who have or are experiencing various forms of social exclusion at the table, alongside the bureaucrats and politicians who ultimately make the policies that affect vulnerable people's lives day to day. Because it is too easy for decision makers and policy writers to become detached from the community they're trying to help, because often their salaries alone exclude them from truly understanding the impact that their choices have on our most marginalised people. I've experienced homelessness in many of its various forms, living in tents, caravans, boats, couch surfing, sleeping in parks, in my car, in the rivulet under the city, as a child, as a teenager, and as an adult. And it was horrible. All forms of homelessness are horrible in their own way. And for a long, long time, I either wouldn't admit to myself that I was in fact homeless, and once I did, I internalized all the guilt and shame that we're taught to feel by a society that believes we all have to pull ourselves up by our bootstraps and not rely on anyone, friends, family, charity, or the state, to provide for our basic needs. If you just worked hard enough, you'd be fine. What sort of functional adult are you kidding yourself to be if you can't even manage to put a roof over your own head? I've never not worked. I got my first job at 14, and by the way, I'm pretty sure kids should be in school and not in shitty paying jobs. Anyway, I haven't stopped working since, and I've always had an income. And while there's a lot that I'm not thankful to my parents for, I'm grateful that they taught me the value of hard work. But hard work alone in this age of globalization, pandemics, and late capitalism is just not enough. We like to think we're reasonably in control of our lives and don't often like to look at all the moving parts that have to align in order for something as basic as housing ourselves to work out. I thought up until recently that I was a failure because I couldn't seem to house myself. It took a friend taking me aside and quietly telling me, you know, it's not your fault there's a housing crisis. And that was my light bulb moment where I stopped blaming myself, at least entirely, for my situation. The reasons for my homelessness are, as they are always for everyone experiencing it, complex. I experienced domestic and sexual violence at the hands of older people as a child, and also at the hands of partners as an adult. So sometimes my homelessness was escaping unsafe situations and having nowhere to go. Sometimes it was because my parents made choices that meant the four of us lived in a tent for months at a time. And more recently, it's simply a lack of affordable housing for people on low incomes in the Greater Hobart area that meant I couldn't find a rental. And while these experiences do not define me, they have certainly impacted on the person that I am, the views I hold, and the values I live. I don't look or sound the way people in my position are expected to, and I probably never will. Standing up here before people who don't look or sound much like me is pretty alienating. It takes a lot for people who've had fewer or worse life chances than those in power to show up and speak for themselves, which is why building lived experiences into our public policies in a way that is not just tokenistic but holistic is so important. Lived experience is more than just a buzzword. And although it's often used as one, it's not enough to simply listen to people's stories of struggle and hardship. To do that is just voyeurism. It's dehumanizing to consume vulnerable people's stories without also empowering them to speak for themselves and advocate for their specific needs. Mainstream politics and media have a lot to answer for this. We are so used to hearing only the controversy and only the things that elicit an emotional reaction to the issue of the day. I've lost my place. Without providing meaningful avenues forward. Media outlets make bank on offering thoughts and prayers. Oh shit, sorry. I wrote this last night and council went till 10 o'clock. I'll start that bit again. Ready? Media outlets make bank on controversial stories. Politicians make their headlines and get their minute in the sun offering thoughts and prayers without policy and change. People who consume these stories get compassion fatigue, and people who share these stories are exposed and spat out to keep coping however they can with their voices still unheard and their needs still unmet. To truly centre lived experience in our policy making is revolutionary. It's fundamentally feminist, which is why I'm all about it. And it's anti-oppression work. Imagine if we truly had policies that were designed for and by the people they most affect. We would have far more targeted, nuanced policies that would directly benefit our community, which would be far more efficient in terms of taxpayer dollars. Not only that, but when we empower people to participate in our community and democracy, we're all better off, safer, healthier, and more compassionate. Because poverty isn't just an individual tragedy, it's a waste of human lives that we all bear a cost for, whether we are directly experiencing it or not. And if you're not convinced by a values, humanist, and dignity-based approach, even the financial argument is crystal clear. It is cheaper to build and give houses to people and provide them with the wraparound support to keep them safely housed than it is to continue our current model, which is forcing people into and out of homelessness and insecure housing, and all of the subsequent and vicious overlapping issues which stem from and are caused by not being properly housed, like mental and physical health, community, law and justice, and all of the services people trapped in these spirals need access to over the course of their lives. Imagine a society where everyone's basic needs were met as a matter of human rights. Imagine if terror of destitution wasn't a constant weight on everyone's experience. Imagine the creative works that society could produce. Imagine the children it could raise, the elderly it could care for, and imagine the inventions it could come up with. And now imagine knowing all that and thinking, nope, we can't have all that because someone I don't like might benefit from it. So to avoid that, the rest of you can get stuffed. And that's modern conservative ideology. Give people homes. If we're truly going to achieve the egalitarian society that we like to suppose ourselves to be, centering folks with lived experience in our work is absolutely necessary. And we as decision makers and leaders need to ask ourselves why it is that these voices are excluded from public life in the first place. Thanks for listening, and I'll see you later for some more robust discussions on this. And up next, I think we have the Federal Housing Minister, who can hopefully provide us with some detail on a federal housing and homelessness action plan. We can and we must do better. So, see you later.
Thank you. Good job.
Thank you, Councillor Jacks. I think that woke us up. It certainly brings us back down to earth around what's really happening and where the concerns are. And it's really refreshing to hear that from a politician, grassroots politician, hey? So unfortunately, our federal minister was unable to be with us today. He has a lot going on with the budgets, is what I was told. So, and from what I see, it is very busy up there in regards to that. But we're very lucky. It is my great pleasure to invite Senator, the Honourable Sarah Henderson, who works quite closely with him for the official launch. She's an Australian politician and former journalist. She's been a Senator for Victoria since September 2019, representing the Liberal Party. She previously held the division of Corangamite in the House of Representatives from 2013 to 2019. Ladies and gentlemen, please welcome Senator, the Honourable Sarah Henderson. Thank you.
Well, good morning everyone, and Kelly, thank you for that introduction, and it is wonderful to join you on behalf of the Minister for Housing, Michael Sukkar, who can't be with you this morning, and he does send his apologies. I do come with some credentials though. I was the Assistant Minister for Housing, Disability Services and Social Services in the last Parliament. And so I have some experience in some of the very difficult issues that you are talking about. And of course, issues that are very close to my heart as well. Look, I would firstly like to acknowledge the Mental Health Foundation Australia Chair, Vasan Srinivasan, for this opportunity to address you on what we consider as a member of the Morrison government two very important issues, the mental health of Australians and combating homelessness. I also just want to say to Councillor Ewan, to Jax Ewan, I thought you spoke so beautifully and from the heart, and you also shared a very personal experience about your own battle with homelessness and other challenges in your family. And I just want to say thank you so much for doing so, because it's stories like yours that really wake up Australians. And I know Kelly made reference to if the politicians won't listen, then the media will. Well, we are certainly listening. And I hope that you can see that we are also taking very strong action on both of these very important issues for our country. So look, I just wanted to briefly address, and I hope you can hear me. Because obviously I'm addressing you from Geelong, my office in Geelong. So I'm expecting that if you can't hear me, you'll let me know, and that the remote communication is going well. Look, obviously this year, it has been an extraordinary year, a year like no other. And the challenges that so many of us face have been amplified in a way that is just really so difficult to believe. I think in Tasmania, you're in a bit more of a bubble, perhaps than other parts of the country, but certainly here in Victoria, we've had very significant challenges with the coronavirus pandemic. And that's had not just profound economic effects, of course, but also profound mental health impacts. And as I speak in Melbourne, Melburnians can still only travel within 5 kilometres of their home. That's not the case in regional Victoria, but that does mean that for many Melburnians, some 5 million Australians, they haven't seen their mother or their father or their children, other members of their family for many months, members of their family who live outside that 5 kilometre zone, and where there's not a caring or other proper basis or an exemption to see their loved ones. So it has been incomprehensible in the stress and challenges that this has presented all Australians. So in the budget handed down last week by Treasurer Josh Frydenberg, we have committed record funding to mental health programs, to supports, an unprecedented $5.7 billion package. And that includes a number of really important measures, such as a doubling of the number of Medicare-funded psychological services available through the Better Access Initiative. That's gone up from 10 to 20 sessions per year. And that means that more and more Australians will have access to affordable and accessible mental health care. And I know for so many practitioners, they say, if we can reach people early when the signs of distress are starting, that can make such an extraordinary difference. Of course, we are also providing record hospital funding across the nation, and much of that funding is used in the context of supporting people with mental health or more acute mental health conditions, obviously including those who do need hospitalisation. But through our primary healthcare networks, the PHNs, which are located around the country, they provide many of the frontline mental health services, including supporting their networks of GPs. So what we have tried to do as a federal government is make and ensure that mental health support is as grassroots in its availability as possible. We've also already subsidised, we've delivered about 7 million Medicare subsidised mental health services since March, which is a very significant increase and demonstrates the level of need in the last 6 months. We've also provided a lot of additional support for really important frontline agencies such as Headspace, Beyond Blue, Lifeline, Kids Helpline, and they're doing an extraordinary job. So please, for those who do need that support, please reach out, because on the ground, again, they are wonderful agencies. And I know in my own region where we've had a real challenge with teenage suicide, we've had a number of teenage boys who have suicided in the Geelong region. that has been extraordinarily distressing for our community. Suicide is such a distressing and traumatic issue that we face as a nation. We know the difference that these agencies are making on the ground. Of course, hand in glove, and so often when people sort of combat or are forced to combat mental health challenges in their life, hand in glove so often is homelessness. And homelessness has been a very central concern of our government and a very important focus of the Minister for Housing, Michael Sukkar. So obviously we well understand that housing security is fundamental to life. It's very hard to function. It's very hard to work. It's very hard to have good mental health, to have good relationships if you do not have housing security. And I know, and I'm sure there are similar programs in Tasmania, but I know in Victoria, there's a special program for older women. And so while we hear about the social housing list, the wait list, which can be very long, I know that there are also specialist streams which will support older women or people with a disability or people in crisis care to make sure that those who are most in need get the support that they so deserve. And I had a situation where an older woman came to me and she was in crisis. She was fleeing a domestic violence situation, and she was able to get and secure housing within a relatively short period of time, despite being told that, you know, there was this terribly long wait list. So there are some really good, at a grassroots level in every state and territory, there are a number of different ways that those facing crisis can be supported. And of course, the federal government is playing a very important role in providing funding to deliver those grassroots programs and housing support. So we're now investing, the Morrison government, in excess of $6 billion to support affordable housing and to combat homelessness. And that includes $1.6 million a year for the National Housing and Homelessness Agreement. Now that actually provides crucial funding to the states and territories. So the states and territories make the decisions on how to spend that money within the funding agreement and how to deliver that support on the ground. And then, of course, there's an enormous amount of investment which goes to Australians through the Commonwealth Rental Assistance Program, something like $4.6 billion. We are also providing, in addition, some $129 million to fund dedicated homelessness initiatives. And that includes a $30 million investment to build more than 100 homes under the Hobart City deal. And that's just one example of how we are delivering specific initiatives in states like Tasmania. I do want to note, and this was of major concern to me when I was the Assistant Minister for Housing, that there is still a disproportionate spend. So, for instance, in Victoria, on a per capita basis, there's a spend of around about $80 per person in Victoria on social housing, which is about half that spent in every other state and territory. So in my own state, I have expressed very serious concerns that we are not seeing enough expenditure from the state government in relation to social and public housing. We've also introduced a number of very important initiatives to enable community housing providers to obtain cheaper and longer term finance, and that's through the National Housing Finance and Investment Corporation and also the Affordable Housing Bond Aggregator. So these initiatives have provided more than $1.5 billion of cheap housing loans, supporting more than 2,200 new homes and the refinancing of some 6,300 existing social and affordable dwellings. And I'm also really pleased to report that just last week, the federal budget included funding that will guarantee an additional $1 billion of loans, again, which will support affordable housing through community housing providers and that will directly support some 2,500 dwellings. Of course, and this is something that Jax has also mentioned, when you have the combination of people, and mainly women, fleeing domestic violence and abuse, that can also create an additional layer of homelessness, and of course increase the challenges when women in particular need to find alternate housing. And so we have actually got a very specialist program for that purpose. It's called the Keeping Women Safe in Their Homes program. And we have delivered some $78 million to provide funding, including $60 million for the Safe Places program. And that is funding some 700 new safe places for women and children escaping domestic violence. I might also say that through the National Disability Insurance Scheme, and I say this in the context of when I was the Assistant Minister for Disability Services, we have an incredibly important housing scheme for those who have acute disabilities. And these are people, obviously, who have the highest level of needs. It's called the Specialist Disability Accommodation Scheme. It supports about 6% of those on the NDIS, and it does provide very substantial housing support to those most in need. And I know when I became the Assistant Minister, I looked at how the scheme was operating. And the scheme was operating by basically saying to those with a disability, look, we'll provide you with funding once you find a house and once you tell us how much funding you will need. And I'd only been in my job for a couple of days and I thought that sounded pretty crazy. And so I said, well, why would we ask people with disability to find a house when they don't know how much money they've got? So we changed the whole system and reversed it completely. And we now say to those who are entitled to SDA, look, here is what you're entitled to receive. Here's your level of need. The support can be very substantial, up to say $40,000, $45,000 a year. And you now know that you have this money available to you so that you can go out and look for a house. And of course, that includes also doing things like reaching agreements with housing investors to give investors the incentives to invest in disability housing. So look, I am really proud on behalf of the Morrison government of the many ways that we are supporting housing and homelessness. There is no doubt it has become a much bigger focus in recent years. And I think it reflects the fact that as a nation, and I think we can proudly say, all politics aside, that we are a very generous nation. We spend about 1/3 of our entire federal budget on welfare and welfare associated measures. But we can always do better. And I'm here to make that contribution to your symposium today, but also to send out a very strong message that the Morrison government very proudly listens to you, listens to your needs, and looks forward to working with your sector into the future. Thank you very much. I wish you a wonderful symposium, and it's been a great honour to represent the Minister for Housing today.
On behalf of everybody here, thank you, Senator, the Honourable Sarah Henderson, for your support towards this year's National Mental Health Month event, Homelessness and Mental Health, here in Tasmania. We really appreciate you making an appearance. And as a thank you gesture, we'll be sending a small token of appreciation your way. So thank you again.
Thank you so much, and have a great symposium, everyone. Thank you very much.
Thanks. I'd like to use this opportunity to invite Marco from the Commonwealth Banker